Hi there, Tracy Kanoski, registered dietitian and functionally trained nutritionist, which means we're always looking for the root cause. So I want to talk today about irritable bowel syndrome. Yep, I know, the thing that nobody wants to talk about, but I'm looking for all of you who have irritable bowel syndrome with diarrhea, and I think you know who you are. That's pretty easy, fast transit time, we all know what diarrhea is. I also want to talk to you about a second group of IBS, that's the IBS constipation, but you may not even know you're in this group. You might just think, well, I have a lifetime history of constipation. I've always had slow motility. I have to drink coffee, take magnesium, stand on my head, do 12 jumping jacks. I have to do all these fancy things in order to have a bowel movement. That is considered IBS constipation. For anybody listening to this, if you're not having 1 to 2 or 3 bowel movements a day that are soft and easy to pass, you technically are going to have some form of irritable bowel syndrome. Okay, so let's just put that on the table. So now, as of the year 2000, Dr. Pimental and his team in LA at Ceders-Sinai identified that 78% of his group at that time, his IBS patients really had what's called small intestine bacterial overgrowth. So let's do a little anatomy. You've got your mouth, esophagus, stomach, small intestine, large intestine. The small intestine should be relatively sterile. There are very few bacteria who should be inhabiting that space. When you hear all of us clinicians talk about microbiome, gut flora, we are talking about your large intestine. So what happens in small intestine bacterial overgrowth is that those bacteria from the large intestine migrate into the small intestine. They're not supposed to be there. It's not a true infection, but they're not supposed to be there. They're just your normal bacteria, but they're in the wrong apartment, right? And so they're not supposed to be there. They disrupt the normal function. So you have malabsorption, you have fat malabsorption, protein malabsorption. You may end up with night blindness. You certainly have gas, bloating, pain. People say that they look like they're pregnant. You can definitely have fatigue. There are a lot of symptoms that go along with this whole picture. So I'm talking to both groups of you today because we now know that depending on what kind of bacteria migrate up and overgrow, if the bacteria produce a lot of hydrogen, you have what is called SIBO-Hydrogen. Those are the IBS diarrhea people. And if the organism that migrates up and overgrows produces methane, he's called Smithii. He produces methane, and methane slows transit time and gives people those hard compacted stools. So both cases of IBS end up being bacterial or organism overgrowth, just depends on who overgrew. And just so you know, you can have both. You might have 2 days in between bowel movements, but then you have kind of a dumping. That can also be a combination of hydrogen and methane, both happening at the same time. So help is here. I've had SIBO myself, treated it and moved on, and now it's time to help you all. I see SIBO every single week in my practice. Again, you guys are the people with gas, pain, bloating. The answer is not to continue to do an anti-diarrhea medicine if you have diarrhea, or to do a laxative if you have constipation. If we treat the root cause, which is to eliminate that bacterial overgrowth in the small intestine, you get your life and your health back. So I see a lot of this. I'm doing several free calls depending on when you're watching this video. My website again is www.healthylifestylesmt4montana.com. Tracy Kanoski, and I hope you can join me on one of the free calls and we can help you get your life back.